Hi, my name is Mickey, and I'm going to be going over the proper personal protective equipment, otherwise known as your PPE, that you're required to wear prior to going in to see a patient. There's three different types of transmissions where you're going to be required to wear this attire. I'm going to go ahead and go over those type of transmissions. The first type of transmission is a contact type of a transmission, and that it consists of a patient who has influenza or meningitis. And the attire that you want to wear is you're going to need a gown and your gloves. And of course, the number one rule prior to seeing a patient is always making sure that you wash your hands. And you will be, if you were to use hand sanitizer, you want to make sure that you get 3 mLs of hand sanitizer and you rub it for 15 to 20 seconds. And then you could go ahead and put on the proper equipment before seeing the patient. The second type of transmission is a droplet type of a transmission patient, and this consists of a patient who has either MRSA or C. diff. And the attire that you will be needing for that one is a gown, goggles, and a surgical mask, your gloves, and again, hand washing. The third type of a transmission is a patient who has an airborne type of a transmission. The patient will be placed in a negative pressure type room. So when you go in to see that patient, you want to make sure that you close the door behind you. And the type of attire that you would be required to wear is your gown and your specialized mask for this one, which is an N95 mask, your gloves, and of course, washing your hands. Okay, so before going in to see a patient, you want to look at the patient's chart so you could see what type of transmission that they may have prior to going into the room, so you can make sure that you have your proper attire. So I'm going to review the patient's chart. So in this case, I'm going to go and see a patient who has an airborne type of a transmission, which is TB. And so I'm going to be getting my gown, my N95 mask, my gloves, and then washing my hands. Now, in case you were to be going into a room with a patient who is needing, if you are needing to wear some shoe covers or a cap, prior to seeing the patient, you would place the shoe covers on first, then the cap, and then your mask, which in this case I'm going to use my N95 mask because again the patient has TB, and I'm going to put this on. Okay, make sure it's a snug fit all around. I'm going to go ahead and place my gown on. Okay, and I'm just going to bear with me here. I'm going to tie it. Okay, tie this around. Okay, just there. And then, we're going to wash our hands, 15 to 20 seconds. Okay, that's dried. I'm going to go ahead and put on my gloves. And you want to make sure that your skin is covered as best as it can be, so you don't, you just want to make sure you're completely covered since you're going to be going in to see a patient with TB. Okay, so now I have all my attire. So I'm going to go ahead and see the patient, right? And then when I'm going to leave the room, you're going to be in a specialized room where you don your equipment on and you remove it. So if you were to have shoe covers on, you would remove the shoe covers off first, and then the cap, and then you're going to proceed with your mask. For the mask, you want to just pinch the mask, and you want to dispose of this in a biohazard type of a container. Okay, and then we're going to remove the gown, and when you're removing the gown, you want to remove it away from you. So I'm just going to go ahead and remove it away from me. Okay, and you want to roll this into a ball, just like this. Okay, and you also place this in a biohazard type of a container. Okay, and now I'm going to go ahead and dispose of my gloves away from me, just like this. You put your finger underneath, away from me, and you dispose of your gloves also in the proper container, and you're going to dispose. And of course, you always want to make sure that you wash your hands, okay, 15 to 20 seconds. And then you're going to go ahead and now you're going to go and document what you assessed on the patient. And that's the proper way on how to put on your proper attire and removing your attire when seeing your patient. Thank you.